What are the thoracic cavity subdivisions explained? Imagine your chest as a well-organized space filled with vital organs and protected by sturdy bones. The thoracic cavity is that space inside your chest, shielded by the rib cage and separated from your belly by the diaphragm. It's a busy area where your heart, lungs, and other important structures work together. To keep everything clear and manageable, the thoracic cavity is divided into smaller parts. These subdivisions help doctors and scientists understand and treat chest-related issues more easily. The first part of the thoracic cavity is called the two pleural cavities. These are two separate spaces, one on each side of your chest, each holding a lung. The pleural cavities are lined with a double-layered membrane called the pleura. One layer, called the parietal pleura, lines the inside of the chest wall and the middle area called the mediastinum. The other layer, called the visceral pleura, covers the lungs themselves. Between these two layers is a tiny space filled with fluid. This fluid helps the lungs move smoothly when you breathe, reducing friction. If too much fluid builds up, it can cause a condition called pleural effusion, making breathing difficult. If air gets into this space, it can cause a pneumothorax or collapsed lung. Next is the mediastinum, which is the central part of the thoracic cavity. Think of it as the heart of the chest, sitting between the two pleural cavities. It contains your heart, the thymus gland, the esophagus, and the trachea. It also holds major blood vessels like the aorta and vena cava, along with nerves such as the vagus and phrenic nerves. The mediastinum is divided into two main parts, the superior and inferior mediastinum. The superior mediastinum is above a line called the transverse thoracic plane, which runs from the sternal angle to the fourth and fifth thoracic vertebrae. It contains the big blood vessels, the trachea, the esophagus, and the thymus gland. Below this line is the inferior mediastinum, which is further split into three parts based on their position relative to the heart's protective sac called the pericardium. The front part, called the anterior mediastinum, is in front of the heart's sac and contains connective tissue, lymph nodes, and leftover thymus tissue. The middle part is the middle mediastinum, where the heart, the pericardium, and the roots of the major blood vessels are located. The back part, called the posterior mediastinum, is behind the heart and contains the descending thoracic aorta, the esophagus, the thoracic duct, the azygos veins, and nerves that help control your breathing and heart rate. The boundaries of the thoracic cavity include the top opening called the thoracic inlet, which connects to your neck, and the bottom opening called the inferior thoracic aperture, sealed by the diaphragm. The diaphragm is a large muscle that helps you breathe and separates your chest from your belly. Understanding these subdivisions helps us see how your chest protects and houses your vital organs. It also shows how different systems like your respiratory, cardiovascular, and nervous systems work together inside this space. Knowing this makes it easier to understand how doctors diagnose and treat chest conditions like tumors, infections, or injuries in the mediastinum or around the lungs.